Hey guys, how are you doing? My name is Dr. Eric Phillips. What we're going to do today is go through a routine to help with low back pain, including disc bulges, disc herniations, and just generalized weakness and soreness in the low back. A lot of it's going to consist of breath work and stabilizing through deep core musculature, but let's just dive right in. First thing we're going to start with is a modified plank. If this is painful, this is the position you want to stay in. If this is too much, then we can rock back into more of a tabletop position. But we're going to go into a modified plank right now. Our goal is to hold this for roughly a minute. So we want to build up to that. Tips that you want to pay attention to while you're doing this is we don't want to be in too much extension here. We don't want to be in too much flexion, as flexion is often what causes a lot of our disc issues. So find that good neutral, get good deep core activation. We're going to sit here, we're going to hold. If this is too easy for you, what we can do is we can lift up into a full plank here. Same, the goal is stay in a neutral line here, work on that breath work down through deep core, and just hold it here. You can hear me taking deep breaths. Nice and easy. We're going to hold another 20 seconds so we can get to that minute mark. With all of these, if you experience pain, back off and do a more simplified movement. This won't be for everyone. So just a little bit longer. Hold that with me. Awesome. Okay, the next one we're going to do is another stability exercise in this position. We're going to go into all fours like this. We're going to extend our right arm out past our head like this. And then we're going to kick our left leg back. And you can see I'm pressing back really far right there, bringing my foot up towards my head like this, and then we're going to hold. The goal here is you want to be able to look down this line here and make sure your hips aren't shifting significantly. Once again, we're going to get into this position and we're going to hold for a minute. This routine has been extremely beneficial for me. I actually am dealing with 2 disc bulges right now and 1 tear in my low back. And I've been doing this, 2 times a day for probably the last 3 or 4 weeks. And the numbness in my foot has significantly decreased, pain has significantly decreased, and I definitely can tell my strength is going up. So we've got about another 10, 15 seconds here. Deep breaths. Good, and then let's switch. So now we're going to bring that left arm up and out, right leg back. You're kicking back like this, trying to stay in a line. Make sure we're not rotating. Get into this position and hold again. Nice and easy. This is something that I've used with a lot of my patients that are experiencing disc issues. It's been extremely beneficial. I highly suggest as much as you can commit to it, 2 times a day, 3 times a day, awesome. But at minimum, if you can do this 3 to 5 times a week, you're going to notice some results. As always, consistency is the most important thing. We've got 10 more seconds here. Perfect. The next thing we're going to work on is a little bit of lateral stability. So we're going to go into a modified side plank. I'm only going to do one side in the video, but you will want to do this on both sides. So after I do the first side for a minute, you're going to pause the video, you're going to flip over, do another minute on the other side, okay? What we're going to do is we're going to go on our arm on this side. You're going to stack your knees like this. We are going to make sure we're activating core here, and then we're going to lift up into this position. This is a modified plank here. The whole goal with this is to hold this for roughly a minute, or you can take 8 slow, deep breaths. So let's go through this. All the way out. Perfect. So at this time, you'll want to pause the video, flip to the other side, do that for another minute or 8 breaths. But let's move on. Now what we're going to do is we're going to lay face down. We are going to extend our feet out as far as we can, squeeze glutes, squeeze quads a little bit. We're going to have our hands stacked underneath our shoulders right here, and we're going to just do a little bit of an extension here. What we're working on here is working on strengthening that low back musculature, the muscles that we kind of avoid and don't utilize a lot when we have low back pain, and that bother us from sitting for too long, because like we said earlier, a lot of what we experience and pain in our low back and disc issues is from being in flexion too often. I will note that even though flexion can cause some of the pain, in some cases with disc, you can feel better going into flexion. So as always, it is good to consult with a professional and have someone do an assessment to determine what positions and what strengthening exercises are best for you. But we're going to get into this position. We're going to hold for a minute. You can really feel your low back musculature activating. If this is causing pain, please do not do this. And down. So in between these, you can take a little bit of a rest. Typically, I take 15 to 20 seconds. Just sit here, decompress, relax a little bit, catch your breath, because it can be actually hard if you're being intentional about your exercises. All right, let's jump into the next one now. We're going to set up exactly the same way. You're going to extend legs out, squeeze glutes here. We're going to bring our arms down a little bit. You can see I'm bringing them from shoulders to make it more like chest. And then what we're going to do is we're going to lift up slightly and squeeze our mid-back. And we're going to focus on keeping low back activated, squeezing mid-back. We're going to go for 10 reps here. Nice and slow. Don't quote me on how many reps I did in this video. I was focusing more on what I wanted you to learn from it. And last one. Perfect. Let's take a little bit of a break. We're actually going to flip to our back. This is going to be the last one we do in this series. So we want to go on our low back, decompress, relax for a second. Now what we are going to work on is getting our glutes, the big booty muscles, to activate. Glutes and core are going to be some of the biggest proponents of a healthy back. The stronger our glutes are, that major muscle group, typically the better our low back feels. So what we're going to do here is we're going to bring ourselves into neutral. We don't want to be extended. We don't want to be tucked. Nice and neutral. Light activation here, feet flat on the ground. We're going to push up into a glute bridge, just like this. In this glute bridge, you're going to feel that activation there. Make sure low back's not doing too much, but feel glutes firing. It's our goal here to get into this position and hold for roughly a minute again. If you have to build up to all of these timelines, that's okay. If when you first start, you can only hold for 20 seconds, give me your best 20-second effort. So we're going to hold just a little bit longer. Keep going. While we're still holding this, I want to reiterate, if you are having low back pain, disc pain, anything that where you feel like stability just isn't great in hips, this can be a phenomenal routine to add to your day. Like I said, when I was experiencing some nerve pain down my leg and all the way into my foot, I was doing this 3 times a day because it was kind of alarming to have that and in the profession I am in. And so I really dived in and committed to that. And within 3 weeks, I felt significantly better. I still have work to do, but this is helping a ton. Just a little bit longer. I'm sure that was longer than a minute, but I need it. And then take a break. The last thing we're going to do actually is a little bit of mobility. This is just to end our movement since we just worked on a lot of musculature there. Just want to work on a little bit of control and active range of motion. You're going to spread your legs just slightly, make sure there's no back pain or hip pain with this. And then what we're going to work on is we're just going to do 5 really slow cat-cow movements, moving our whole spine, making it feel nice and buttery and smooth. Thinking about how if we commit to this and do it, we're going to feel phenomenal. It's going to change our life. And you're going to learn how to do it kind of on your own. Last one. Hey guys, if you like the video, if it's helping you, reach out, let me know, give me some feedback. If you ever need any specific help, let us know. We work at Identity Chiropractic. This is actually our gym side as well. So if you're looking for some fitness, look at Everyday Athlete, Health Club, online. I'd love to help you. Have a great day.